All right, guys. I have somebody who has given me what their bar is. They want to have 0 COVID cases for 14 days. Otherwise, masks forever. And that's what I've told them. It is masks forever. You know what would be really instructive for you to do? It would be really instructive for you to look online and go to the Worldometers, if it pleases you, or even go to the World Health Organization website and look at the number of diseases that have never gotten to 0. Like I give a for instance, because I was looking this one up. For instance, tuberculosis. There are 1.5 million people a year that die of tuberculosis, including about 250,000 kids. So if we had the measure that none of us are ever going to be able to go out of our houses without a mask until we get to 0 cases of tuberculosis, then essentially what you're calling for is a bar to have mandatory masking forever and ever. Amen. So look, I understand that there's some who have that position. I'm just letting you know, I think Cochrane has a reasonable position. What is the level of risk to the community? They've drawn the bar at 10 cases, and they say if they get above 10, mandatory masks. If it stays below 10 for 14 days, then the mandatory masks come off. I just think there needs to be some parameters, and you guys tell me what you think it should be.
All right, let's talk coronavirus versus TB. So points 1 to 4 here. TB is far less contagious, obviously. TB rates are stable in Canada and various other places without further interventions. TB should anyways be taken more seriously. There are 0 cases of TB in several communities already, and many countries have 0 cases as a goal. And furthermore, mask forever is not a big deal. And just 10 cases of COVID is an improbably precise metric. Let's go over each point. So points 1 to 4. Turns out that a majority of TB cases are either in the foreign-born population or the Indigenous population. I don't know why Danielle didn't go into the numbers here, but as it turns out, it's also very regional disease, with the territories being most adversely impacted. So let's talk about that. So in this report on Canada.ca, it goes into why foreign-born populations are more impacted, about how different experiences they might have, brings back latent infection, or how they could how travel to certain countries may have caused the infection. And also it talks about how in certain Inuit populations is attributable, as they say here, to inequitable access to healthcare and the social determinants of health. And they say the case rates might be going up because the testing is going up, which is a good thing. Testing doesn't create disease, it finds disease. So let's test more in the north of Canada for TB. This is something we should, a number we should drive down. And in the report, that is the goal. The ultimate goal is TB elimination. There's no sort of base rate tuberculosis that the Canadian authorities want, right? The goal is 0. And if you dig a little further, you can find other articles. And those other articles say interesting things about the TB infection rates, right? Why are people in the north more vulnerable? There are several factors that contribute to much higher rates of infection in the north. Many Inuit people live in overcrowded homes that are poorly ventilated. They're very airtight, right? Does this sound, it sounds very similar to what people are experiencing with COVID. You're in a poorly ventilated space with many people. It's not good. So the government should address this. And it can do 2 things at once. And as for masks forever, I took a picture of a Costco before all the COVID rules and after all the COVID rules, and it looks very similar. So I'm not sure what great failure masks forever would be. I think masks in a grocery store, I'm not sure about the great human tragedy wearing a mask at a Costco is, but maybe some conservative talk radio can fill us in on that. Now let's go into let's wear masks after 10 cases. As it turns out, the city of Cochrane in Alberta, has this bylaw that will mandate masks at indoors and in places where you can't social distance if the COVID cases become, there's 10 active COVID cases. And the idea is some guy working for the town is going to check this map maybe once a week, maybe every day. I don't know the specifics. They're going to click on this map. They're going to read this active cases number. And when it's 10, then the alarm bells will finally go off and they will wear masks. But until then, it doesn't matter what the rest of the bubbles say on this map. It doesn't matter what's happening right next door. They could have 1,000 cases. It doesn't matter if no one's being tested. I presume they're just going to click on this bubble, and if it doesn't say 10, then everything's cool. And if it does say some number over 10, then they'll wear masks until they're under 10 for 14 consecutive days. I don't know why they chose to make it this needlessly confusing. I think it's more simple to just wear a mask, but someone needed a job checking this map every day, I guess. And in terms of the possibility of only 10 cases, and this is something that you might be seeing in the news lately, is this study done on the transmission within an overnight camp in Georgia for the month of June, where all staff and campers were required to provide documentation of a negative SARS-CoV-2 test less than 12 days before arriving. So everyone going into the camp was tested negative before arriving, right? And what happened? Well, what happened is of the 597 people there, 260 got it, right? So at what point do you find out within this camp that there is precisely 10 active cases, right? They did not. They did not test everyone every day. Someone got sick, and then you find out later how badly you screwed up. So the idea that the city is going to find out, precisely 10 cases, or that they have a good handle on where they are right now, is kind of a joke. Also a joke is the idea that this is anyway comparable to TB. If TB behaved like this, the society would be locked down, right? If you had a 40%, 44% infection rate in a population in a month, you would change your lifestyle. Now, in this age groups, Danielle Smith would be the first to say that the 22 to 59 age group would be the most adversely impacted and at risk of a fatality. And the fatality rate is what a lot of people talk about all the time. But the fact is, the transmission in the lower age groups impact the transmission rate in the higher age groups, and there are other things to consider other than fatality rates. For example, Herman Cain passed away in the last couple of days, and that was after he spent basically the month of July in the hospital. There's also ER doctors who have spent many weeks and months after getting infected, or other, not only ER doctors, but other healthcare workers that have got coronavirus and spent weeks or months in the hospital. And this is an adverse effect that is decidedly not fun. But in the data, these are kind of whisked away as if they don't matter if all you're looking at is fatalities. So basically, what we have here is the pinnacle of whataboutery. What about tuberculosis? What about fatality rates being lower in different age groups? It's like sitting in a room, burning room, and asking about forest fires and asking to universalize all behavior in all situations, which is just ridiculous and distraction.